Hello everyone, my name is Mohamed Rajab and I'm an internal medicine trainee at South Warwickshire NHS Foundation Trust. This is a research done with my colleagues Dr. Amjad Al-Jurudi and Dr. Adil Al-Alwan at Salmaniya Medical Complex in Bahrain. The title of A Public Survey on Financial Incentives for Kidney Donation in Bahrain. So what's the research about? A quick introduction. End-stage renal disease is a major cause of morbidity and mortality in Bahrain. In the year 2000, the annual incidence of end-stage renal disease was estimated at about 120 per million, and the estimated mortality rate of hemodialysis patients was around 10% annually. Although kidney transplantation is the optimal form of renal replacement therapy, there is a lag actually in the annual numbers of kidney transplantation in Bahrain due to shortage in kidney donors. A sincere debate has been taking place over the last decade about introducing financial incentives to increase the numbers of living kidney donors, despite the fact that financial compensation for organ donation remains largely outlawed by nations across the globe. It can be argued that introducing financial incentives for kidney donors is the only effective strategy to generate sufficient kidneys to meet the growing gap between supply and demand for donor kidneys, and where lives currently lost awaiting kidney transplantation could be saved. This is due to perceived failure of altruistic organ donation programs in which donors or their families do not materially gain from donation. So basically, some researchers think that the only and effective strategy to increase the number of kidney donors is by introducing a financial incentive program. Several authors seem willing to consider a regulated system of paid living kidney donation, given that certain conditions are met. For example, an equal reimbursement for all donors, which can be expressed in money or other valuables like health insurance benefits. So in this study, we aim to assess the public awareness and acceptance of financial incentives for kidney donation in Bahrain. Subjects and methods. So we adapted a previously developed Dutch questionnaire to investigate the public opinion on introducing incentives to increase the number of kidney donors. And this questionnaire aimed to explore public opinion for two different kinds of fixed compensation, either a lifelong health insurance compensation or a 10,000 Bahraini dinars. And basically 10,000 Bahraini dinars approximately is 20,000 pounds. In addition, we investigated public preferences for two different types of practice. Either the patient himself seeks a donor or the donor registers for a donation at an independent institute. The questionnaire consisted of 8 questions with multiple choice answer. A total of 446 participants filled out the questionnaire, and then we analyzed the results. Here we can see the subjects, distribution of the demographical data of the participants. We can see, for example, gender, we had 174 male and 272 female participants, and the research was done in Bahrain, so majority of participants were Bahrainis. Age in years, we see that we had a large number of participants above 50 years of age. Social status, married participants were more than non-married, and as Bahrain is a Muslim country, the majority of participants were Muslims. We also had the educational level, we can see that most of the participants were university graduates, somewhere below that, and 86 participants were with postgraduate certificates. Employment status, majority of participants were employed. Monthly income in Bahraini dinars, about 160 participants received more than 1,000 Bahraini dinar as a monthly income. And we also asked the participants whether at the time of filling the questionnaire they had health insurance or no. We can see that 331 participants did not have health insurance at that time. Here are the questions of the questionnaire. I will quickly run through them. The first question was, how do you estimate the chance that you would donate one of your kidneys to help someone you know who is on the waiting list for transplantation? For instance, a family member or a friend. And the participant would respond to this question with either never, very small, small, intermediate, large, very large chance, or if he already donated or is planning to donate his kidney. The second question, how would you estimate the chance that you would donate one of your kidneys to help someone you do not know who's on the waiting list for transplantation? And the response would be similar to the first question. The third question is, would the chance that you would donate one of your kidneys to a patient on the waiting list increase if in turn you receive an attractive financial compensation? And the participants would respond, not increase, possibly increase, or definitely increase. The fourth question, would you consider it a preferable or a rejectable development if health insurance companies would decide to offer living kidney donors quite some financial compensation to increase the number of kidneys for transplantation? And the answer would be a very adverse development. Adverse development. Not an adverse, not a preferable development. A preferable development, or a very preferable development. And the next question, imagine that health insurance companies would indeed decide to start offering compensations to living kidney donors. Which of the following types of compensation would you consider most preferable? And the participants will answer with either donor receives 10,000 Bahraini dinars, donor receives lifelong health insurance, equal, the donor should be able to choose, or neither, I am against the system. And then imagine that there would be such compensation-based system that causes more persons to donate. Do you consider it acceptable that kidney patients try to find themselves such donor in order to get transplanted? And the participants will say definitely not acceptable, not acceptable, intermediately acceptable, acceptable, or definitely acceptable. And the next question is, if you had to choose between the following, which option do you consider best or the least bad? And the participants will say, a kidney patient find himself a donor for 10,000 Bahraini dinars. A kidney patient find himself a donor for lifelong insurance. A donor donates to the first one on the list for 10,000 Bahraini dinar, or a donor donates for the first on the list for a lifelong health insurance. And the last question is, if a compensation system was a reality, 10,000 Bahraini dinars and a lifelong free health insurance, how do you estimate the chance that you would donate one of your kidneys to receive such compensation? And the participants will either say never, very small, small, intermediate, large, or very large. Now I will only mention two examples of the answers. The first one is for this question, how would you estimate the chance that you would donate one of your kidneys to help someone you do not know who's on the waiting list? We can see the results here. 106 participants said they would never do that, and 98 said very small chance, and we can see that less participants said that the chance is large or very large that they would donate their kidney for someone that they do not know who's on the waiting list for transplantation. And the other example is, if you had to choose between the following, which options do you consider the best? We can see that the majority, 219 participants, said that a donor donates to the first patient on the waiting list and receives lifelong free health insurance. And 122 said that a donor donates to the first patient on the waiting list and receives 10,000 Bahraini dinars. Now, in general, of the total participants, 39 were male and 61% were female. 80% of the participants believed that their chances for kidney donation will not increase in turn of receiving a financial compensation, while 20% of them believed that it will increase. We learned that 58% of participants thought that the situation in which health insurance companies would introduce financial incentives to increase the number of living kidney donors is preferable. Our study also found that generally married participants find it a preferable development for health insurance companies to offer financial compensation for kidney donation, while non-married participants found it not a preferable but also not an adverse development. Furthermore, there is a positive correlation between age and preferable views toward financial incentives to increase kidney donation. Now, looking at our results, our study predominantly showed that the public willingness to donate a kidney in Bahrain will not increase with financial incentives. Now, trying to think of reasons to justify this finding, we think that one explanation for this could stem from the fact that most of Bahraini public are practicing Muslims, and they might view receiving any form of payment for organ donation as immoral and irreligious, whether in the form of cash or a lifelong health insurance. Furthermore, even though many Islamic councils have ruled in favor of organ donation, there are theological dilemmas that might interfere with Muslim decisions to donate an organ, such as the belief that on the Day of Judgment, their bodily parts and organs will testify before God. And how can such testimony occur if an organ has been donated away in life or after death? Another explanation might include kidney donation unawareness and fear of health-related complications and kidney failure post-donation, and thus they weren't persuaded by the proposed financial incentive. As noted in the Dutch study, the public's reluctance toward reimbursement in cash is likely due to linking the notion of money for organs with the negative reports of exploitation of the poor and the awful activities of organ harvesting. In both previous similar studies, younger people were more supportive of ideas on introducing incentives to increase in the number of living kidney donors. Interestingly, in our study, we found the contrary, where older age groups were more in favor of the introduction of financial incentives and donors receiving lifelong health insurance from an independent institute. This might reflect that older age group in Bahrain have more awareness about the kidney donor shortage and the suffering of participants on the waiting list. To conclude, overall, more than half of participants were supportive toward introducing a system with fixed compensation to increase the number of living kidney donors. Most participants preferred a system where the donor would register at an independent institute to donate to a patient on the list and in turn receive lifelong health insurance compensation. Older age and higher income were positively related to approval of ideas on introducing incentives for kidney donation. Despite that, the public willingness to donate a kidney in Bahrain is not likely to increase with financial incentives. Thank you very much.